Last month, Governor Gavin Newsom visited San Diego to propose a bond measure that could provide more mental health resources across the state.
To set aside and prioritize the most acute challenge the state faces, and that's the issue of the integration of housing and the supportive services that we need to be stacked on that housing to stabilize individuals that are in acute states of psychosis, people that are self-medicating with drug or alcohol addictions.
San Diego is one of many regions facing a mental health crisis. It's on the streets and in jails, in our classrooms and houses. But what that crisis looks like minute by minute is rarely seen. Reporters with the San Diego Union-Tribune spent months taking a deeper look. Here are some of our starkest findings. Over the last 3 decades, the rate at which people were placed on 72-hour mental health holds has almost doubled for adults and increased nearly tenfold for kids. Mental health calls for service to law enforcement have spiked by more than 120% since 2009, creating backlogs at all levels. Hospitals are struggling to staff the hundreds of available psychiatric beds, and people who are discharged sometimes have nowhere to go. Over the past decade, the county has lost 68 residential care facilities that had supplied spaces for more than 500 people. Unsurprisingly, the largest provider of mental health care in the county isn't a hospital system or a nonprofit or a crisis center. It's jails. During just one 3-day period that we examined last year, law enforcement in San Diego County received at least 238 mental health calls. People called for help from transit centers, schools, and homes. At least 90 people were admitted to psychiatric facilities, and 5 took their own lives.